Hi, I'm Lisa Buksbaum, CEO and founder of Soaringwords. Today it's my great pleasure to introduce you to Dr. Richard Tedeschi, an expert in post-traumatic growth and one of the leading positive psychology practitioners in the world. Dr. Tedeschi is a professor of psychology at UNC Charlotte and a licensed psychologist specializing in bereavement and trauma. For the past 20 years, Dr. Tedeschi has led parent bereavement support groups. Working closely with Lawrence Calhoun, he's published several books and more than 105 scholarly articles on post-traumatic growth, a field of research that they developed that examines the transformation in the aftermath of trauma and life events. Thank you for coming to New York City and welcome to Soaringwords.
Thank you, Lisa. I'm very pleased to be here.
When bad things happen, people feel as if it will break them. Dr. Tedeschi, could you explain what post-traumatic growth is?
Lisa, in addition to the distress that comes in the aftermath of various kinds of traumatic events, people often find that they learn something of value, they change in ways that they value, they experience what might be for some a personal transformation. So this struggle in the aftermath of these traumatic events to cope with them and to figure out how to live with this difficulty and the outcomes that people experience in the aftermath of these events we call post-traumatic growth.
Scientists like you have been studying post-traumatic growth for the past 30 years, but actually the concept of post-traumatic growth comes from ancient traditions.
That's right, Lisa. We've given this scientific name to it, post-traumatic growth, but it's a concept that has been explored by theologians and philosophers for centuries. So you find in the great religious traditions a lot of discussion of how we should respond to suffering in our lives. If you look at Judaism, Christianity, Islam, Buddhism, Hinduism, they all have something to say about this aspect of human living that's inevitable. So we find that there's a great literature on suffering and transformation. And then when we look at philosophy, especially the existentialists have talked about how we are inevitably going to experience some kind of suffering or trauma in our lives and how we should respond to that by trying to find some meaning despite the suffering. So we make meaningful suffering. Right. So not just suffering in vain. So for example, Viktor Frankl, who is a Holocaust survivor, is almost a father to this field in modern times, right, because he described how going through the concentration camps he found some way to make that time and that difficulty meaningful for him, and he had a sense of purpose that developed out of that.
Right, the sense that the last freedom that one has is the freedom to choose one's attitude towards circumstances. We can't control our circumstances, but we can control how we respond to them.
That's exactly right. So what we've done now is we've tried to learn about it from a scientific perspective. That is, we've tried to look at what are the data that support the idea of post-traumatic growth. And we've found, for example, that maybe half to two-thirds of people report post-traumatic growth.
Half to two-thirds, that's very encouraging.
Yes, it is. I mean, it's not an uncommon thing. It's not a universal thing. But more people report post-traumatic growth than report post-traumatic stress disorder, for example, in the aftermath of various kinds of traumatic events. We're not talking about the trauma itself creating the change. We're talking about what people do in the aftermath of the trauma, how they get through it, and who can be around them, right, that can help them make that difference so that they find something of value in it.
Can you tell us about the different domains of post-traumatic growth?
Post-traumatic growth is different for every individual person. So there are different ways that people report that they've changed, transformed, etc. So we've identified 5 different general ways that people talk about these things. One is a sense that they're stronger than they ever thought they could be. So going through the traumatic event has been a great challenge to them, but they have found personal resources that they've drawn on, and they've identified that they have this personal strength that they didn't realize before this traumatic event. A second domain is appreciation of life. This is the whole idea that people have talked about to stop and smell the roses, perhaps. Right. Appreciating the time that you have here on Earth, appreciating the things around you that you might otherwise take for granted. A third domain is the idea that people can relate to other people in a new and better way, perhaps being more compassionate, more empathic, more understanding maybe allowing themselves to get closer to other people emotionally. And this happens because when you're going through a traumatic event and you're doing the disclosure about these events, you are almost forced to get closer, to expose yourself in some way. More vulnerable.
Of the armor.
That's right. So this generates perhaps a new way of relating to other people. A fourth way that we find people reporting post-traumatic growth is new possibilities. The events that they're experiencing sometimes shut off old ideas of what's important, priorities that they had, goals that they had, and it ushers in new priorities. Now they think other things are important, or they set new goals for their lives. So new possibilities start to open up in the aftermath of some traumatic events.
That's what happened to me during the height of my son's illness. I was walking along the beach and I had this epiphany when I realized that millions of children were suffering with serious illness like my son Jonathan. I had this knowingness that I was going to create Soaring Words to embrace all these kids and their parents and the healthcare providers taking care of them. So really it was those experiences with loss and trauma in my family that opened up the future career path for me and really me living my purpose.
So Soaring Words is the new possibility in your life.
Right.
And in other people's lives, of course, now too.
Right.
The fifth area of post-traumatic growth is spiritual change, which encompasses different kinds of things for people. For some people, that's a strengthening of religious beliefs and practices. For some people, it's not so much that, but a spiritual or existential change in their lives where they understand living in a different way. There's a depth and a sort of profound nature to living that they recognize that they hadn't recognized before.
The preciousness, the sanctity of things. I found spirituality could be a loaded word. I mean, I think what we're talking about and what you often write about is some people could find that in nature or music, the healing power of music to transform and elevate us, whereas others might find it in a more religious way through prayer or chanting. But whatever the way that works for the person, it's noticing and appreciating these moments of sanctity and awe and wonder in our lives after we've been touched by something that's been hurtful or traumatic. Can you tell us how you got into the science of post-traumatic growth?
My colleague Lawrence Calhoun and I decided we wanted to know something about wisdom, and not too much had been published in the scientific literature about that. So we started by interviewing people we thought might be wise, including older people who had been bereaved, people who had gone through difficult medical situations, illnesses, accidents, and such. And we, in these interviews, heard their stories, and in those stories there were themes of post-traumatic growth. So we learned from them first about what post-traumatic growth really is.
Dr. Tedeschi, one of the things that you talk about is this notion of self-disclosure, which can be really helpful in facilitating more post-traumatic growth. Can you tell us what self-disclosure is about?
Well, it's talking about your own experience. We usually do that in conversation with another person, but there are ways that can be done through journaling or through artwork, other methods of expressing yourself. And it's important that whatever method it might be, that both the negative parts of this experience and the positive parts of this experience can be disclosed. Disclosing all these things about yourself, you get to learn about yourself because you're articulating your experience to someone else, having to explain it. And in doing so, you start to pay attention to what you're saying and learning more about your own experience as you articulate this whole experience.
It's part of the process of sense-making, like bringing meaning and sense to these very painful experiences.
Yes, I think you start to pay attention to some things in your own experience that you might not have clearly thought through before.
So it's taking the trauma or the serious situations that are happening and making that part of one's personal narrative.
We all have stories that we're writing about our lives, and kind of in our minds we have our own autobiographies being written, and these traumatic kinds of events disrupt those narratives, those stories, and we have to start rethinking what the story is.
And that's the whole notion of we can't choose what happens in our life, but we can choose how we, our attitude towards that and how we show up and making the most of each day, being grateful for things.
So the narrative could include those things, that this terrible thing has happened to me, but here is how I've chosen to respond to it. And where is this going to lead me in my life? What kind of person is this going to create in me? So that new narrative is something that people start to describe when they talk to other people about their experiences.
Right. How can other people be helpful to facilitate more post-traumatic growth?
Other people are really important in this process because they can help the person who's going through the traumatic event face up to it in some ways. It's important not to avoid it. You have to embrace it in some sense, in that you have to take a look at how it's affecting you, how you're thinking about things differently now. And another person can be encouraging of that process. So Lawrence Calhoun and I have talked about this in terms of expert companionship. Mm-hmm. We want to see other people learn how to support trauma survivors in this expert way. Not expert in terms of being a professional, but being a really good companion. Someone who is able to listen to difficult stories, someone who doesn't offer platitudes, someone who can actually learn from the person who's going through this difficulty, rather than think they have to have the answers to this person's problems. So it's an attitude towards listening, supporting, being a presence for another person. That person who is traumatized then gets a chance to articulate their experience, explain themselves.
And be with those feelings and those experiences.
Right.
In their way,
in a safe atmosphere.
Right.
So that they can start to learn about their own way of responding to all this, as difficult as that might be.
That's what happened with my family. The expert companions were so essential to our healing. After my brother died, many of my mother's friends would come to the house and take her for long walks to the local park or in nature. Just spending that time together was so important and so healing for her. And for me, when my father was hospitalized and my oldest son was ill shortly after Gary passed away, my expert companion was Krishna, my children's babysitter. She always had my back. She knew what to say. She knew how to be there for me. She always said the right things. And sometimes she just would give me a hug.
You know, I think the hug is maybe more important than anything else. In some circumstances, there really aren't words.
Right.
So that presence, like your mother's friends gave her, and that presence that Krishna gave you, knowing that somebody is there and you can count on them, that's perhaps the most important thing of all. One of the things that is so difficult for people who go through different kinds of traumas is when people start treating them as if they're different, they're not them anymore.
Right.
And they're disconnected somehow.
Right.
So the expert companion is someone who stays connected.
Does an expert companion have to be a medical professional or a therapist?
Medical professionals and other kinds of professionals can function as expert companions for sure. But the ordinary people in our lives, the non-professionals, sometimes are those that we'll be able to count on even more. They can be closer to us and be there more often for us. So those people are often the most important expert companions.
Dr. Tedeschi, thank you so much for all of your wisdom and warmth today. Being with you is so affirming and thought-provoking, and all of the work that you've done over the years on post-traumatic growth has changed so many lives. So on behalf of everyone watching today, thank you so much.
Thank you, Lisa, and thank you for giving me the opportunity to help you and Soaring Words help patients and families, and I look forward to working with you more in the future.
Great, thank you. Soaring Words is the power to heal.